Hey, what is happening? Welcome to another show of the Research to Reps Roundtable. I am your co-host, Dr. Coach Pat Ivey, and with me is Dr. Ted Lambrinides. Ted, what is happening?
How you doing, Pat? I'm doing great. I like your new background today. That's a nice feature to the program.
Trying something
And
new here. Trying something new. Yeah, and we also have Dr. Ernie Reimer. Dr. Reimer, what's up?
I'm everything's up right now. I mean, it's fall, like everyone's fired up to start school. We got all of our teams in preseason camps. We got new background, backdrops on the call here. It's baseball season, and I'm really excited to have this guest on. This is Dr. Tommy Otley from Miami, University of Miami Athletics is doing some really cool stuff. They're growing in sports science, but one unique thing I find about Miami is that they have some full-time physical therapists in their athletics department, which is actually kind of rare in collegiate athletics. So, Tommy, welcome to the podcast today. Feel free to introduce yourself, but I'm really eager to dive in on what physical therapy in the athletics department looks like.
Yeah, absolutely. Thanks for the introduction, and I'm really excited to be on here with you guys. I've watched this podcast, and it's fantastic. I really enjoy the atmosphere you guys bring and how the discussions can go. So excited to be here today. And yeah, like Ernie said, from University of Miami, I'm a physical therapist for men's and women's basketball there, as well as helping with sports science integration with the teams there as well. We're growing and developing in that area. And much like you guys have put some really good content out there about what that can look like in a college realm, we're growing and developing like that now too. So it's exciting to kind of hear from you guys here a little bit about that, and then talk about PT and how that can work in college athletics too.
Yeah. Can you tell us a little bit more about yourself? Where'd you come from and why did you get into physical therapy? Why college athletics?
Yeah, absolutely. Not as good as you as a college athlete by any means, but I was a college swimmer back in the day. And so college athletics is close to my heart and definitely brought me back. My brother had some injuries in high school, and so that got me into the medical interest, and then especially physical therapy. Went to PT school at the University of North Georgia after finishing my swimming career. It's definitely done. But it was a good time. Moved on from there to Duke University, where I did a residency and fellowship program. There are two separate programs, really diving into sports medicine and what that can look like in the physical therapy realm. My first exposure there was in the residency program, where really just diving deep into sports injuries and working with their team of orthopedic surgeons, athletic trainers, more with the high school outreach program. So seeing a lot of different sports, a lot of different athletes. And then I got lucky enough to stay along for another year where I did their fellowship program. And that's immersive in Division I athletics. And so everything occurs at Duke Athletics and happens in and around all the teams there. So I started out with football there, worked a little bit with soccer as well. And then got the wonderful opportunity to be involved with basketball there too in Coach K's final season. So that really kind of pushed me into that direction, and really strong interest, as well as what they were kind of growing and establishing in sports science there too. After that, had a great opportunity once basketball season was done to work with their lacrosse team. Wonderful program as well there. So still a little bit of variety in sports. My role there as a fellow was managing long-term injuries for those teams, and really another university uniquely has a lot of physical therapists embedded in the athletic department too. So had a good roadmap for what that could look like, and Miami's been doing it for a while too. So got the opportunity to move here to Miami and continue that with basketball, and it's been an awesome experience so far. Great season, good year.
Now, Tom, how do you manage? A lot of times you have the coach that will say, "Hey, this person just tore their ACL. Adrian Peterson came back, and he's better than ever after 9 months." Or I heard that this program they're using different orthobiologics. How do you manage the landscape of a lot of times the coach is reading the headlines of the papers and not necessarily the research that you're familiar with?
Yeah, I think it's a challenging thing with anybody. There's a lot of pseudoscience being shown everywhere, and a lot of timelines that maybe get misconstrued all the time. So I think it's a challenging landscape for any healthcare professional or anybody really in the sports medicine performance realms to manage when it comes to teams communicating regarding an athlete coming back to play. I know for us, it really relies on our consistent and direct communication across all platforms to the coach, that the athletic trainer, the physical therapist, strength coach, we're all meeting, we're all communicating, we're all saying the same thing. And it keeps us all on the same page. I think you guys, with your this maybe to Pat and to Ernie, you guys have developed your that comprehensive model that you guys are kind of establishing. How does that help you guys in communication and maybe sometimes avoiding these issues with coaches where maybe something gets misconstrued or they've heard one thing from someone else or the news or something? How does all that communication from everybody in different pieces coming together help keep things straight?
You said a word, how does it help us avoid? I don't know if we avoid,
Okay.
but I think it allows us to adapt and adjust better, because I think coaches do what they do. They know the X's and O's, the technical, the tactical. Some have a better understanding of the physical preparation. More are diving into the mental side of the game. Some are developing better understandings of the science behind it. But we have still grown, like health and performance is growing everywhere. More professionals are trying to find ways to work with each other. So I think it's not avoiding, but it is adapting and adjusting and being able to have those conversations with each other and having that foundation laid. But Ernie's in the trenches on that, so sure he can give you some details.
Yeah, thanks. In some ways, I think it provides strength in numbers, maybe, because here's an example. Just yesterday, we're in a staff meeting. So it's the coaching staff and health and performance team for one of our preseason sports. The coach asks a question and brings some belief to the table about an athlete. And so here's the context. The athlete has had a surgery. They've gone through some return to play. Now we're getting close to competition. The athletes handled a massive amount of activity during preseason, and the coach is just like, what can we do right now? Because this athlete clearly isn't where they need to be by game day. And we're like, one of us speaks up and says, but there's not a whole lot we can do. Maybe we need to let the athlete recover from what they've gone through. And then all of a sudden, in this room, we have 2 sports scientists, we have strength conditioning coach, we've got 2 athletic trainers in the room, 2 dietitians in the room, we have mental health and mental performance in the room. And so we have this strength in numbers, and everyone in their own way kind of shared the same idea to the coach. And the coach said, you know what, Ernie, I hate everything you just said, but it seems like everyone's on board with that. So I guess that's what we got to do. So and sometimes it's strength in numbers. And another example would be like that. No one here is the smartest person in the room. We've got lots of doctors, just like on this call, doctor, right? We've got lots of doctors, and all the time it's like, hey, well, don't take my word for it. Maybe we can pull in Dr. Daly on this, pull in one of our primary care sports medicine physicians. Maybe we can pull in Dr. Carmen, our physician who focuses on sleep medicine. And so it's like, sometimes we can just pull someone in just to have a conversation. And again, it gives that added support and authority to be able to kind of communicate and have those difficult conversations with coaches. But, one of the words you mentioned earlier is, you said the word pseudoscience. And my understanding is that pseudoscience is this idea where maybe this is groupthink ideology. Maybe the strength in numbers, like I just described, could be guilty of it. But it's like where a group of people maybe have these common beliefs or these ideas or these principles or theories, which is mistakenly thought of as like legit science, or these ideas came from the scientific method. And would you be willing to give maybe just like one or two examples of some of the pseudoscience you hear that comes from coaches kind of in the rehab, physical therapy, sports medicine realm? Like, what are some of the common pseudoscience ideas you get?
Yeah, I think an easy one is training volumes, and I think what that exposure can look like for injury risk. A lot of times people think that um, that just because we're training really hard that it's a bad thing, you know. And I think the whole load monitoring topic that's come up in recent, you know, news debate, all that, a lot of times can be seen as a bad thing. Volume can be seen as a not good thing. But I think dosing and having the right exposure to sport is protective against injury too, right? We've seen that in some literature as well. So I think that's an easy one that comes to mind for me. Is that just because there's a lot of volume doesn't mean it's a bad thing. It's just got to be dosed in an appropriate way. I think maybe more into the sports medicine side is just timelines for injury. A lot of times, you know, we look at literature and most of the return information is based on a certain time point, whether it's 9 months for ACL or 12 months for an ACL, or a certain time from injury, where there's a lot of other qualities that for those that are not in the health profession or in the performance profession may not be as aware of, where we have to have adequate strength to return, got to have adequate ability and motor control to come back to sport too. But I think those are some that pop out to me. I think again with pseudoscience, I was more referencing just the maybe some of the critiques that I have for when we feel like we know something, but there's not a whole lot of information to back it up. And I think, you know, there's a lot of development in sports sciences, which is answering a lot of those questions too. And I think you guys have been a little bit at the forefront of that too. So for you guys, what do you, I think some of the ways that you've maybe addressed that with your staff, where we have these ideologies that we bring in before, and then we have to kind of question them and with the support of research, with the support of stuff that's out there, as well as the internal maybe audits we're doing in our own practice and things that we're finding with our own staffs and teams.
Sounds like Ted wanted to take that one.
No, in my visits to other teams, I think you hit it, and that is the collaborative effort of doing auditing. You know, what's the latest? You know, what could be the latest relative to a case study, not necessarily, you know, I would say a full-blown study. And I think looking at, you know, what are the physiological mechanisms? Is this practical? Does it follow some evidence-based guidelines? And figuring out, do we try with this athlete or do we try with that athlete? But I think you're spot on in terms of discussing those processes as a group in terms of the pluses and the minuses of those.
Yeah,
because we're in a situation now where you know, hey, I just visited school X, and they're doing some cutting edge stuff with their sports science. And you might say, well, I don't think that's particularly cutting edge, but that's sort of how, you know, with the recruiting process, the transfer portal, stuff that they hear, it's how to address those internally, and as well, keeping a straight face with the recruit and their parents.
Mm-hmm.
You know, you can't say, well, what they're doing at that other school, I wouldn't do.
Right.
But have to be professional at the same time. So it's, I think it's tough to navigate those waters sometimes.
Mm-hmm.
I have a question for you, Tommy. Some people may struggle with seeing the research and science behind physical therapy, because most people's experience with physical therapy is they had an injury, they were hurt, and they think of some exercises that their physical therapist prescribes. So describe some of the research and science behind what it is that you do And maybe for someone that's out there listening, because I'm hearing more and more people that are interested in going into physical therapy. Maybe they've been in other professions and they want to change and pivot. What information can you share that can maybe bring some light to what it is that you do and what the foundation is that you do?
Yeah, absolutely. I think that's a great question. I think a lot of times physical therapy can be a little bit misconstrued about what we do and what it looks like. There's a wide variety of professionals that lay in the physical therapy landscape. I think that can be one of the challenges as well to the identity. Whether you're in the acute care system, you're working in the hospital, or you're working in outpatient orthopedics. For me, it's with the team. It's in the team setting and embedded in the college athletic setting. So for us, it's all sports injury based for the majority. Um, and we rely again a lot on collaboration with other professions and a lot of this literature too. So we're definitely outputting a lot of literature ourselves as a physical therapy profession as a whole, and have some really high quality journals that a lot of that is coming out of. Journal of Orthopedic and Sports Physical Therapy is one that comes to mind, and so um, uh, research coming out of that can blend from everything from epidemiology of injury to good treatment approaches. And then, a lot of interest to us is return to play and what that looks like too. And so identifying what goes into good, high quality return to play for an athlete, what are injury, maybe risk mitigation factors that we can be looking at as a whole, as well as uh, collaborating with other professions on what they're doing as well. So different surgical techniques may be something that we see a little bit in collaboration with physical therapy, and what treatment approaches were better or worse. I think another one that's really strong is a partnership with strength and conditioning, and a lot of the literature that we utilize is coming from Journal of Strength and Conditioning Research, or and that as well, and making sure that we're not just programming exercises that are your band exercises, your shoulder table exercises that you typically see, but we live in the weight room with you guys too, and it really is a hand-in-hand approach to bringing athletes back to where they need to be. And a lot of times there's a lot of crossover between when I'm done with them and when the strength coach is done with them in different ways and different aspects too. So I think that's all the background of it. I think then when it gets into the practical side and to the rep side of what we do, it really looks a little bit more varied sometimes. We got a great blueprint of what things should look like from the literature, and then it goes hand in hand and we figure it out in terms of what it's going to look like in our team, in our setting for this athlete to go from the injury back to the court again.
Yeah, that's good.
Tom, one of the trends I've seen in the in visiting some of these NFL teams over the last month is you'll have a player who's not injured, but he's not normal. He's a starter. Let's just say he's had major shoulder surgery, and he just has to deal with it. And I've seen the PTs actually, in the weight room when that individual's working out, and the PT has a special program for that individual. So it is a great collaboration between the strength coaches, PT, and you see it in action in the weight room where, for these series of exercises, he's working directly with the PT. Once that series of exercise is over, he goes back in with the regular workout of the day. Is that a model that you've seen, firsthand, or that you actually install there at Miami?
Yeah, absolutely. I think we have a lot of cross collaboration. We get them back into the weight room as quickly as we can because it's really important to their development athletically. And any modifications that we need to make, we do. And then I think the same goes. You see the same thing on the court for us too. We'll do the exact same thing you're referencing with the sport coach too, where me, the athletic trainer, will be standing by and jumping in as well for different drills, things we're getting them back to. It's not as simple as non-contact practice, contact practice. We're really trying to develop skill and getting them back to the specific movements that's required by their sport too. So if they're learning how to do a pro hop or jump stop, we may want it to look good. We want it to be everything that they need, and they're ready for it when they get exposed to it. But we don't want to waste time and not give it to them when they're not ready for it too. So we try to be present and available to be there in all those situations, as well as the collaboration in the weight room where they might finish a lift with the strength coach that they're back to with the team lift, and then come with me and we'll knock out a couple extra things, more accessory type stuff that they need, just because of the injury too. It takes a lot of coordination too, I'd say as well, though. You have all these schedules of everyone that's working with the athlete. You have the strength coaches putting volume in the buckets. You got the sport coach that's putting volume in the buckets, and me that's putting volume in the buckets, and the athletic trainer is putting volume in buckets. And so making sure that all those pieces are communicating really well, I think is really, really important. We do that with weekly, like, formal meetings with the team, with our sports team in basketball. And then but then every day it's on staying on how do they respond to this? Do we need to pull something here, add something here, and kind of move that dynamic puzzle forward as things are going. I don't know if you guys have found other ways that work for you guys in that communication. Maybe Aaron, you mentioned some of the conversations you guys have had before, but what does that communication look like for you guys? Is it regular, formal, or is it more kind of day to day on the fly a little bit?
Well, I think it really just depends on the team, really. So here at U of L, so our senior director of sports medicine, he's our only like full-time physical therapist, and he's been with us. He's very talented, and he oversees our sports medicine department. And we've started to integrate some physical therapy with some of our teams, in particular men's basketball. So I'm curious to dig into this a little bit more. But you know, when you look at collegiate athletics and you look at how the health and performance teams operate and how they communicate with each other and with the coaching staff, it highly varies. And I'm sure you've witnessed this, but it highly varies. You have some groups who are probably in the upper echelon with how they communicate, probably along the lines of what you've just described. But then you have some groups where the communication isn't great. And a lot of times, like in college sports, you don't have like a high performance manager for each sport necessarily. And so you kind of have to depend on whoever the liaison may be for that sport. It could be an athletic trainer, it could be a strength coach, it could be the head coach. And so their ability to communicate and create that formal communication, that informal communication, being transparent, keeping track of all the moving parts, it really comes down to that pseudo leaders' ability to manage and what their leadership and their management qualities are. So with that, you just get this wide array of models in collegiate athletics, because each sport is kind of its own little world. And if you have the opportunity to observe those, you can see the best and the worst probably in every athletic department, to be honest.
Yeah, I think this is a good opportunity for a little shameless plug for your new article that came out.
We definitely talked a little bit about that for sure.
It was great.
Yeah, I mean, we just we've worked on it. Dr. Ivey was on that, the authorship, and the article is comprehensive integration of athlete health and performance through sports science. And we did talk about like how the limitations in collegiate athletics limit our extent to really bring the high performance model to life for every sport and every athlete in collegiate athletics. So we do talk about that. But I'm curious about this idea of like you talk about the volume in the buckets and how you all communicate that. Like, do you think, how could technology possibly play into that? Like, how could technology possibly play into understanding the physical and non-physical stressors that your athletes are experiencing in every area: athletic training, physical therapy, on the court, strength and conditioning, and possibly outside the court, like academics and personal life?
Yeah, I think that's a great question. There's a lot of great things we have pieces together for that now, I think, and there's a lot of holes in it as well, with what technology types we're using and the different things that we have accessible to us. And I think for me, first thing comes to mind is on-court volume is always pretty calculated for us. We use accelerometry type monitoring for that, and so that's been a staple for us in terms of just determining what's going on and how much volume that we have on court. But I think it gets a little more challenging when you leave the court, too. Like, what does the weight room reps look like, and are we actually putting numbers to that um, uh, uh, from that standpoint? And then I think even more less frequently used in rehab too is, how do we quantify this as a whole exposure of a session on the athlete? And then, as you mentioned, even more difficult when you get into what is the classroom type exposure as well. So I think we do a really good job of what that looks like on court, and a strong job as well in the weight room in terms of what total volume exposure is. A lot of times, uh, and the way that we do it, I'm kind of the final piece. Not that the rehab doesn't come first when the athlete's coming back, but we try to piece these things together in a way that I can oftentimes adapt and modulate in my rehab a little bit more easily and quickly on the fly than maybe what we have programmed for the team in lift, or even if it's a lift for just that individual athlete. It's a lot of times easier for me to be flexible, move something here, piece this together, move that to tomorrow, and kind of be the uh, the person opening and closing the hole in the bucket just to make sure we have enough or not enough. I would say that as a whole, though, I think that's a challenging question. I think, especially as you move further and further away from the court or the field, what technologies are we using to do that? For us in the weight room, you can use um, just your reps, sets, weights as a measure. You can use bar speed, as a good option too, and different exercises for rehab. I think it's been less explored. I don't think we do a great job at quantifying how much it is outside of maybe just that volumetric capacity. Something else that we do is just RPE for our athletes too, just a simple session RPE. And look at that over time too. But that doesn't really dig into the weeds of where that's coming from as much, but oftentimes serves as a talking point for us and them to kind of explore further in a non-numerical way. And then the classroom, I got to be honest, I don't do a whole lot with that, and so I think that's a great landscape to grow. Is there ways that you guys are doing that currently? I don't know if Dr. Ivey, kind of on the mental preparation, mental health side about that too. Are there ways that you guys are collecting information in a more formal way on that end too?
I would say we've made some really good strides. There's more to go. There's more room for improvement. I know the efforts that Dr. Reimer is leading. It takes time because it takes resources, it takes people, it takes finances, and where things have worked in the past, sometimes there's reluctance and hesitance to adopt something new, especially when it comes to technology. There might be a concern of, is it sustainable? Is it scalable? Is how valid and reliable is the new technology? Because now you have to, when you start incorporating more technology, you may have to incorporate more disciplines, and that's different. That's different. Whereas maybe one area may have owned something in the past, now you start bringing in technology. You start having to bring in other professionals that have expertise in certain areas, and it takes time. It does, and especially if you're an early adopter, or you're kind of out in front leading, and maybe others aren't quite there yet. There's a hesitancy, and sometimes you can't start with all the sports teams. You want to start with one sports team, and then you have to consider, well, who's going to want it next, and will you be able to deliver, and do you have the people, the time to be able to deliver it? And you have to have the support from administration as well, because administration can't come to you and say, well, why aren't you doing this with this team, or why are we allowing this to happen over here, and there's no what's the plan for it happening everywhere.
Right.
It takes time, people, resources, a lot of communication, and sometimes there's insecurity. You mentioned the mental piece. It's not just mental piece with athletes. There's a mental piece with the professionals that we work with, personalities and experiences and biases, and there's a lot pressures. The pressure that our coaches and your coaches and all coaches are under in general. Uh, you know, all of those things come into play. And we have to be able to manage those things and manage those expectations and those relationships. And, there's some politics at play as well. Yeah, we have to be able to manage those. And it takes making mistakes to learn how to improve and move forward as well. And so we have to be, my role as an administrator is to be able to allow the time and space for people to grow, adapt, make mistakes, learn, problem solve, and be supportive. And I think we need more of that. And then I think we can expand people like Ernie and those roles and your roles. You feel more confident about trying something new and different and expanding when you have that support.
Yeah, so, absolutely.
Yeah. What do you think, Dr. Reimer?
Yeah, I mean, there's a lot of ideas that come to mind there. I think that you said at the very beginning, we're making forward strides, and I think we have a lot of well thought out aspirations to identify currently like where we are in certain areas, like what really is like kind of cutting edge or state of the art. But anyone who has something cutting edge, like when you cut the edges, there's like some trash on the ground around it, right?
Yeah.
So there's always like that. Yeah, there's always a little bit of garbage that comes with being cutting edge or state of the art. So there's always a little bit there that you can clean up. So I think we have really well thought out aspirations. Like you talked a little bit about on the mental side, and like, so we historically have over the years, we haven't had a lot of mental health support, and now we have 5 mental health professionals, 5 mental performance professionals. When we just had 2 total, athlete income surveys, a lot of pen and paper on things, just getting records on athletes on some of the different mental health, mental performance kind of questionnaires and things. And we now have aspirations to go toward more electronic information on the mental and health and performance side of things as intake, but also being able to follow up with athletes at different intervals to understand, cycles of things and what might be going on. So hopefully, like, if we can fulfill some of these strategic plans and bring some of these things to life, it's going to kind of give us some type of objective lens into maybe what the athletes are experiencing off of the court. Because earlier you said, as you get further and further away from the court, kind of looking into their worlds is more difficult. But some of these scales that are out there, mental health, different types of mental health scales, different types of mental performance scales, like they can give you some idea that some things are happening, and then those feelings change over time. So we have aspirations to improve. We've made strides. We are cutting edge in some areas, but again, we still have some things we need to clean up and improve for sure.
Yeah, absolutely. I think, go ahead, Ted.
Listeners out there, do you go over some of the differences in terms of how you might program BFR for an injured individual versus a healthy individual? How those might vary.
Yeah, definitely. I think that's a great question. There's a lot of good information in that. So blood flow restriction training, for those who may not know BFR, is where you use a tourniquet type compression around the limb that you're working with, whether that's an arm, lower body, leg, usually up towards the arm here, you'll see it, or up at the upper thigh. What it does is it reduces blood flow to the limb, and has a partial occlusion of the limb. And there's a lot of some really interesting research out there on what it can do in terms of giving you the opportunity to still improve strength and still improve cross-sectional area of muscles while training at reduced load. So I think for us at me particularly, oftentimes managing athletes right after surgery, it gives us a lot of great opportunity to work with athletes at giving us some physiological benefits at that lower volume or lower resistance than we typically would like to load the athlete to. And then I think the second thing that's oftentimes overlooked is the perceived exertion that you get out of the athlete at that time point. A lot of times that they feel like, oh, I can't really work hard. I'm lifting this low ankle weight, say post ACL, you're doing some knee extensions. It's 2 pounds. It doesn't feel that hard, but we could rep out 30 of them, or we can add BFR, maybe get a little bit better physiological benefits, but you also get the feeling of a really intense workout from it too. And I think that aspect of perceived exertion can be a huge benefit as well. As we move towards the continuum, that the athlete's a little bit further along, there's not as much evidence that BFR is the most beneficial thing, and you got to put load through the athlete. You got to have some different inputs to the body, and resistance training, high intensity resistance training is going to be superior to BFR at that point. So I think BFR's role changes a little bit as you get further along, and it can be more of a recovery type device than maybe the core part of your program that you're using from a strength standpoint. So for us, if we have athletes that are on a day that's on an off day, but we still want to get some physiological benefits, we may even just pop the BFR on and do lower load resistance work. So you're not really disrupting from a mechanical standpoint, putting a lot of mechanical disruption on the tissue, but you're still getting some benefits from the physiological standpoint without that. It might look like biking with it on. It might be doing some body weight exercises with it on. Walking with it on has been something that our athletes like a lot. Just especially we even use that as a recovery modality in rehab, where we had a great workout yesterday. We're gassed, but hey, I'm standing on the sideline. I can't do anything. My teammates are playing. Can I just pop the BFR on and walk up and down the court while they're running up and down it? Yeah, sure, let's do it. So I think there's a lot of good uses for it there. I don't know if you guys have seen anything different, or if that's similar to you guys' approach too.
I know that we incorporate BFR, but I use it personally. What is difficult is I actually have the units where I can move around and be mobile, but
yeah,
some BFR units there's the unit that you have to wheel around.
Yeah,
you really can't be mobile with it. So do you find that there's those limitations with the unit that is you can't really take onto the court? Like, do you use those differently?
Yeah, I think there's you got your gold standard ones more towards like I don't want to name names products, but but you've got your main ones that have the tubing connected, and you're getting an automatic adjustment in the flow of how much pressure you have during exercise. I think there's some limitations to that. We do our best to keep them charged up and let them walk around with them if we're doing that kind of exercise. We've had the opportunity to have a couple different types of sets, whether that's us personally have them or we have them as a university too that we try. And there are some other options out there too. And then there's the practical, I hate to say this, practical BFR, but when they just do a wrap or something like that too. And so I think there's some flexibility for those who don't, maybe not in the same setting where you can afford a unit that big. There's been some research on the safety of that and it being some efficacy to doing that too. but I think it definitely can impact how you do it. But then, just like any other thing that we have, on the road, we may have less equipment. We have different things. We're flexible and work around it, and maybe change up the programming a little bit, but try to still get the same desired effect out of it, too. Going back to what Pat, you had a question. You said it a little bit earlier about all these new technologies that we're bringing in. What is the challenge of maybe being a technologist versus really diving into how this can answer questions for us? There's always the new hot thing coming out, and the new cutting edge tool. How do we stay focused in an area where we have all these different vendors or different things coming at you with new technology, but how do you keep it moving the goals of your program forward and answering the questions of those performance coaching staff that they have? How do you find if something's going to be helpful or not helpful?
Wow, that's a good question. That's a really good question. I don't know if I feel like that is something we're working on every day.
Yeah.
I think you know that because
same for us. That's why I'm asking.
every day. I'm going to pass it over to Ernie. This is definitely in his wheelhouse, and I'm just here to support him.
Yeah, it's a great challenge. A lot of anecdotes. I mean, just driving home here before this podcast, I was talking on the phone to a former intern, and he's become just this mathematics whiz, and he was a math major as an undergrad, and he's done some internships with some pro teams, and he's doing like coding and really high level coding languages and stuff, and he doesn't have he's working for a second professional sports team and second sport in pro sport, and he's like, I think I'm ready to get a master's degree, and I'm thinking about wanting to get a master's degree, maybe in like some exercise phys or some biomechanics, because I'm finding that like I'm really good with all this math and I'm good with all this technology, but sometimes I don't have a strong enough foundation in the exercise sciences to be able to answer some of the questions that were being thrown my way. So just happened today. So I mean, you served that one up. You didn't know that, but
it's funny because sometimes I come from the other aspect. We as people who started maybe as a physical therapist or strength coach, we're kind of trying to reverse engineer that whole process. So I think, yeah, it's a great thing to bring up.
Yeah, and then the other piece is a lot of times I think that we think that technology is sports science, right?
Right.
Technology is a tool that we usually use to collect data, but not all technologies, because you just talked about BFR, and that is a technology. That technology is being used for an application that has been derived through the research.
Right.
So not all technology is for data collection, but for the most part, a lot of the technologies you're referring to are to collect data. And collecting data usually has a reason. So prior to that, we have some questions, or we have some goals and the reasons why we want to collect that data. And then we have to analyze and go through the rest of kind of the scientific method to get to the outcome. But I think that we as sports scientists, athletic departments, we should take a little pressure off ourselves when it comes to technology, because my view on it was that, think about your toolbox in your garage, or if you have tools, and like I have a lot of tools. I buy tools. I like to own my own tools. They are technology. But just because I have the tool doesn't mean that I have to use it every day. Right? So, and some of those tools have some overhead on them, like a chainsaw. You got to replace the chain, you got to do oil, all kinds of things. And I'm going to pay for that subscription over time, but I'm still not going to use the chainsaw every day. So I think we should just take some pressure off ourselves when it comes to technology. We get the technology, we know what it's for and how we want to use it. And we use that technology when a situation with an individual athlete, a scenario with a team, a scenario with a certain group of athletes who might have certain factors that line up. When it calls for us to use that technology for some reason, then let's apply it, but not get too concerned about just because we have it, we have to use it and figure out why we got it in the first place. It's more like we're getting it for this reason, and we'll test our athletes when that reason comes up for those athletes.
Right.
Use the tools when you need them. Don't put so much pressure on yourself to constantly have to use them just because you have them.
Right. I like that a lot. That's great.
I got a question for you. So we're going to have some fun here. This is the research to reps roundtable. It's where we go from like the research to the rep level. And we've talked about a lot of things like return to play and everything like that. So case study. Okay. Tell me how, you know, what would the rehab and the return to play process look like for 41-year-old male, recreational, fast pitch baseball player, plays 2 to 5 games a week, and maybe less than 7 days ago, 6 days ago, like pops the hamstring twice during a steal to second. Like, how are you gonna get that guy back and ready for the playoffs next month?
Good question. It sounds personal, or at least someone you know.
Asking for a friend.
Asking for a friend. Yeah. Yeah, no, that's a great question. So, you know, without divulging into too much information about the injury, but yeah, I think one, what is your expectation of return? That's a quick. You got a month now, right, to go back. I think first you're going to look at what is the injury history leading up to that. Have there been any other prior injuries going into it? All that, understanding if this is the first or second type they've had a strain, or maybe multiples before that.
If I recall from the injury history, it would be
the
ever hamstring strain.
The first time. So yeah, I think understanding that's helpful. Knowing the severity of it, which is oftentimes tough and a little debated about how you determine that. I think that's a good one too. Are they walking and able to move well, or is it pretty laid up? If you want to go a little bit more into the ways you can consider that, even if there's bruising, if there's point tenderness, how long it's tender along the hamstring can be another helpful thing. Might give you a little bit of a timeline on things as well as there's a test called the H test you could do, bringing the leg up, swinging it down, giving a little resistance to it. You can kind of determine if that's painful too, understanding if they're going to be more of a quicker timeline or it's going to take a little bit longer too. So I think from that initial injury, obviously a little bit of acute management there. Hopefully whoever it wasn't hobbling off too much. But then after that, I think when you want to get him moving, get him back and to being able to do daily movements well. So first, just being able to do your eating, walking, going to the bathroom, all that stuff without too much issue and doing it well. And then from there, starting to move into more compound type movements, getting them back in the weight room. This is from a general progression. And then I think during that time, get them back with whatever they're doing strength training wise and movement wise, as well as addressing the isolated tissue deficits too. So if there's some strength concerns, gradually loading that up and building the capacity. Pat, look like you're going to say something, but
I am, because there's something else I want to know with this with Ernie's friend.
Yeah, speak up.
Yeah, I also have just in my experience, I've heard from people that do the rehab that you also have to consider the psychology of the injured athlete. So with Ernie's friend, if that person is having some, like, what challenges have you seen from the mental side that may impede or improve the rehab process?
Yeah, I mean, Ernie's friend is a dumbass. Like, Ernie's friend really wants to be out there competing again. So might have done a little bit of competition since then, within just maybe a few days of the injury. But yeah, so there's a lot of motivation and competitive spirit to want to get back out there for sure. But Ernie's friend doesn't really have like a full health and performance team, physical therapists, athletic trainers, and strength coaches. Maybe some friends, but not an actual people who are looking after their health and well-being. But now to move away from this case study, let's say this person did have like a comprehensive health and performance team. You've hit on some really, really important things earlier in the podcast. Like when we get to that time where we're getting close, because you mentioned that time frame is often like one of the big things you always hear on pseudoscience. It's not just like, hey, in 3 weeks they're cleared. You talked about the role of the strength coach. Dr. Ivey brings up the mindset of the athlete, the individual. I mean, when it gets to time to return to play, talk to me maybe some of the nuances, like who's involved in that decision to return to play, and then who's involved in like the decision to return to compete, and what does competition look like for someone when they first return to competition, and then what does like return to performance really look like even after they've returned to competition?
Yeah, absolutely. I think there's a lot of great tiers to that and a lot of levels to that discussion. First, I'm going to talk a little bit, kind of reference consensus statement from British Journal of Sports Medicine and their practice, play, performance type continuum that you have. And so as you're getting these athletes towards that end stage, it's not just hey, you checked all the boxes, you go back, but you haven't done anything that looks like sport before, and now you're good to go. I know that working in the clinic, before I got into college athletics, that's a hard thing to create. But when you have that team of all these different providers, you have the sport coach involved, you can be introducing sport way before they're getting close to the time point in a safe way and build on it from there. Other than that, you've got the opportunity to hear from everybody. I think, when the clearance may come from the team physician, or the clearance may be part of the athletic trainer's decision, or depending on how your roles are set up in the different institutions. But I think everyone has some type of voice in what that looks like. Everybody who's worked with the athlete should be able to explain what they've done well, where they need to grow still within that certain discipline too. And so we try to have everybody involved in those discussions, especially when it's one of these longer term time loss type injuries too, because everybody's going to bring something different to the table that they're identified. The sport coach may be like, hey, they're not impactful enough because they can't move enough well on court that even if you cleared them and gave them to me, I'm not going to be able to play them. They're not going to be effective. And so those are hopefully holes that we've tried to address before we get to that time point, and everybody communicating. But I think, it's everybody saying that. I may be, from an ACL standpoint or hamstring standpoint, I may be like, hey, their hamstring symmetry is down still. But I remember, I think this is at ACC conference with you guys. When you guys presented, Dr. Ivey and Dr. Reimer, you talked a little bit about ability and symmetry, and that little conundrum between how is there an asymmetry? Okay, maybe there's some asymmetry, but they're really, really strong to their body weight on both sides, and they're kind of in the zone where we want them there. Then maybe I'm a little less worried about, hey, there's a little bit more asymmetry, 2% more than I would like to see. Then I feel pretty confident they're going to be able to return because they're really strong. Where you have somebody who's really weak to their body weight, one, that's a problem. But then two, if we have a big asymmetry on top of that, it just further compounds it. Where the strength coach may be having a completely different perspective on their quality in terms of what they've gotten back to in the weight room, and what they're able to lift prior to their prior maxes, prior ability. And then the sport coach may be like, well, they used to hit 60% from the field, shooting just during practice spot shooting, and now we're at 30. They're not going to be that effective, not going to be helping yet. So that's something we need to build in that standpoint. So I think return to that doesn't mean they don't go back to practice at that point, but it may be they're not going to be effective enough on the court yet. And how can we build that? And then I think everybody speaking at the same table, so I'm running a little long, but everybody speaking at the table together helps us identify who can best address that. Is it a strength problem? Is it a mental health problem? Or do we need to bring in sports psych to help them. You know, they've got great strength, they've got great thing, but they're crapping out in the race, or they're just not there, and having difficulty in that standpoint too. Then can we support them and give them resources in different areas too? So I think having everybody involved in that discussion is important to make sure it goes in and we're able to provide the resources are there. Can we provide them in the best way too?
Great response, Tommy. Last question will be, what books would you recommend to some of our listeners for today, that are in your wheelhouse? And it could be professionally or as well as, personal development.
Yeah. What books? That's a great question. I love that. Well, let's go with just professional development first. I really like Mastery by Robert Greene. It's been a helpful book for me just to continually to dig and get better at what I'm doing, and never be satisfied with how far I've gotten. Be like, okay, I understand that. Well, let me dig through and find somebody who's better at it than me and try to learn it from them again. There's some really great stuff in that book. I think my dad worked for Dale Carnegie for a long time, and so How to Win Friends and Influence People is a huge important book for me as well. And I think that's been really reflected in the coaches that I've had the opportunity to work with, having strong leadership principles and having the ability to connect with the coaches in that standpoint has been helpful for me, both working with the specific coaches I've had that's important parts of their program. So I think being able to communicate at that level with them has been huge, and speak a common language on that stuff. From a sports standpoint, been reading a lot of research. I think books wise too. One I have been recently finishing is Adam Petway's book on basketball biomechanics. That's been a great read for me. I was a swimmer and then transitioned into the field court sports after. And so I think moving and thinking of sport in a little bit different way from a biomechanical standpoint has been a cool thing for me as a PT to see how does that apply. And when I look at an athlete and I'm doing that visual or video analysis of how they're moving, is it back to what they should be moving like? And I think that's helped me to make a transition mentally when I'm looking in sport and when I'm visualizing sport to see how it looks. So great stuff coming out of Louisville again. But I think that stuff has been helpful for me too.
Well, thank you so much. Thank you for joining us, for your time. Looking forward to connecting with you, whether we're down there or you're up here. Love to show you around and maybe around town as well if there's time.
Yeah, absolutely. I appreciate it. Excited to be in the ACC with you guys and see where the conference is going. I think we've got only nowhere to go but up. I think we've got a good groundwork and a really cool collaboration going on between a lot of the schools now. It's exciting to see.
I agree. Yeah. Thanks, Tommy. I knew you were going to bring it today. You definitely didn't let us down. And I know that the audience is going to just love to hear what you have to say. So we really appreciate it.
Awesome. Thank you guys for the opportunity.
Enjoyed it.
Thank you.